So one of the biggest challenges now in the juvenile justice system is in our evolution and trying to create really a system that's separate from the adult correctional system. The creators of the juvenile justice system envisioned a system that would be fair to young people, that would be preventive in nature, and that would be rehabilitative in its impact on young people and families. The system has really struggled to separate from the adult system and to decide which practices would be truly developmental for young people and to really define what young people are in need of those interventions. So those are really some of the biggest challenges, is how do we move to this developmental approach that the science really tells us actually works with young people and with their families.
Well, I think I concur with Tim that, there certainly are challenges, but I think here in Florida, a lot of those challenges we've seen as great opportunities in working with our communities and really focusing on the needs of our young people through assessment and really understanding by evidence and research what is going to drive the best outcome for our young people.
So one way to really address the challenges and really capitalize on the opportunities that are available for juvenile justice reform is to really fundamentally examine our overall approach. So what I would say is that we have to sometimes start from a different place if we're going to change our destination. So if we want to get a different outcome, we have to begin with how we view the young people and their families and how we view our involvement as a community in their rehabilitation. So we really try to start with the belief that young people want to do well and succeed, that families are vital to the treatment process, that challenging behavior is really an attempt to meet a need, and that we have to help young people in their development to learn to meet their needs in healthier ways that are going to be more productive and ultimately more fulfilling, so they can move on to a prosperous adulthood where they contribute to their communities. It's also important to realize that it's not the system's responsibility alone, that it takes supporting families. It involves natural supports for young people and their families that are going to be there long after the system is no longer involved. So it really takes communities getting involved in meeting the needs of young people and in supporting families for the system to really work and to work effectively. Most of the young people that we're talking about do not actually need extensive juvenile justice system involvement. What they need is our interventions and supports and opportunities in their communities.
Well, I think certainly the key to any reform work in any system is collaboration. And we have been very fortunate here in Florida to really have strong partnerships with our key, I'd say, the key stakeholders, our law enforcement, our state attorneys, our public defenders, and just community in general, and working with providers and advocates. If the collaboration is not there, there's no way that a system can strengthen communities to a point where we can keep kids in their communities and keep them from going deeper into the system. And that's a critical piece of what we're doing in Florida here in juvenile justice, is really strengthening communities so that we can have a more focused effort on the kids that really need to be in our system and in the deeper end.
What we have in this country is a number of different models. One of the most common threads are models that are really an adaptation or a change from the adult correctional model, and we may in some cases use some of the same words, like we might talk about incarceration, or we might talk about probation, or we might use many words that might lead people to believe that we're talking about an adult correctional model. So that's really one of the opportunities, is to begin to not only change our language but also change our approach so it's more aligned with the developmental needs of young people and families, and so it's more aligned with what we now know through research actually works to prevent future offenses, what many might call recidivism. But in our case, what we want is for young people to not only lead a productive and law-abiding adulthood, but also a prosperous and fulfilling life. So we know what works. The challenge often is how do we apply that and reorient our systems to what works. We know that a least restrictive environment is one starting place. So in Missouri, we invest a significant amount of resources in front-end diversion, so that hopefully young people don't have to progress deeper into the system. But then once they do, assessing the risk and needs and strengths of each young person to figure out what the appropriate placement or service is going to be. Some young people are going to be fine being in a group home for a period of time, or perhaps a day treatment center where they can go during the day and then go home at night, and where their family can be highly involved. Others might need to be in a longer-term residential setting, say of 6 to 12 months, but even in those cases, they need to be placed close to their homes, where their families can be involved and where their communities can actually be involved in their care and in staying connected to those young people, so that those supports that they're going to need as they transition are going to be there, so that they can be successful when they return to the community.
Well, in Florida, we're fortunate to have the full continuum. We're able to serve kids in prevention, we have diversion, we have probation supervision, we've got secure detention and residential. So it really has allowed us in our reform work to, while we are downsizing one end of our system, to really shift the resources and focus efforts on the front end to keep kids from coming into our system. Our goal is to keep communities safe and serve kids in a manner that will keep them from going deeper into the system. We have done a lot of focused work on the deep end work, much like Missouri has done with normalization, and really having the right population there. We have done tremendous work with our research and data and assessment, and really allowing the assessment tools and the data to drive what we do with our individual kids. Every child is different on that, and every community is different. So each community has many different needs, and we've really been able to shift resources around to meet the needs of those communities so that they are stable.
So I think one thing to keep in mind in our juvenile justice system is that if we use a developmental and rehabilitative approach, if we build the right types of supports and interventions around young people and keep them connected to their communities wherever possible, it is possible to achieve exemplary outcomes. So young people present certain symptoms to us and are acting out in certain ways, and certainly that challenging behavior has to stop. The question is always how to stop that behavior, how to change that behavior to be more productive. We know there are interventions that work. For instance, in Missouri, we focused significantly on educational achievement, and over the past 6 years, we've increased our completion rates by over 85%. So now almost 50% of the young people in the system leave the system with a high school diploma or a GED. 86% return and are productively involved in their communities, in school and work and service projects. And 3 years later, 93% have avoided further incarceration, and 67% have avoided any further system involvement. So we know when we implement services and programs and supports in ways that are rehabilitative and in ways that build on the potential of our young people, we know they can be very successful when they can become contributing members of their communities.
Of the youth leaving our commitment programs, 46% recidivate, and of that population, nearly 60% do so in the first 4 months. So we have, over the last year, re-engineered services to be transition reentry services, where we work with the young person as they're leaving the residential facility to really wrap them tight with services. We get them vocational training, help them find a job, we work with their families, we get them educational services so they can complete their GED. Really some of those basic things that many of us were given as we grew up, to really ensure that they've got the resources they need to be successful when they go home. We know many times that we can do the best job we can in residential, but if we're putting them back into that same exact environment where the environment is and not any stronger, that it poses a huge challenge for those young people, and in many ways sets them up to fail. And so we really try to focus on working with the families and identifying, safe, healthy places for our young people to go back to, and then ensuring that they've got a network around them of mentors and case managers and people that are going to be able to connect them and get them to their services that they need so that they can be successful.
So one of the things that has been a significant improvement opportunity in juvenile justice is how do we sustain the gains and the improvements that might be made while young people are in services or in programs. So there's been a significant emphasis on what many would call reentry. I don't like calling it reentry, I'd rather call it transitions, because we're really talking about a transition back to community, and reentry is is more of an adult correctional term. So if we want to think about transitions for a minute, we know that effective transitions actually start from day one. So from the time that a young person comes in contact with the system, we should be thinking about what relevant services and supports are going to be put in place that are going to be durable for them in their life, that are going to last beyond the actual program that they're in or service that they're participating in. We know that we have to engage families in the work because young people grow up in families and they heal in families and they need to be supported in families. So first, believing that families are vital to the treatment process or vital to the transformation process for our young people as a starting point. It's a philosophical point where we believe in it enough that we make it happen even though it's really difficult. Then secondly, thinking about how we engage families in the work. So part of what we do in Missouri is that while a young person is in a program, we have a service coordinator that's building a relationship with the family, that's actually conducting home visits, and it's conducting outreach, and is identifying needs and supports and so forth that will be there for the family. That's helping the family identify their hopes and dreams that they want to pursue. Building on that family expertise, because we take the view that the family knows their young person better than anyone else does. They may not know exactly how to address the challenge before them, but they know what the young person likes to do. They know those moments when they've been proud of them. They know what success in the family has looked like at times where they felt successful as a family. And our job is to have more of a facilitative role to help them get back to that spot. To help build on those hopes and dreams, to build on those strengths that exist in the family. So we have to take that approach. Sometimes it means calling families together. It's as simple as having flexible visitation policies where families can have a lot of involvement with their child and where maybe they can interact with other families and then maybe implement deliberate multifamily groups and other strategies that support families. In some cases, in our day treatment programs, family members, parents have been able to participate in the educational program. So we've had instances where a young person and their mother or their father have received their GED at the same time or in the same year and have participated in a graduation ceremony together, which is a significant milestone for the family that helps build family success, family identity, and momentum that can propel a family forward to a more successful, prosperous situation. So it really is staff getting creative and believing in it enough that it happens, and knowing that no matter what we do, we will not be able to replace the support that comes from a young person's family and community. Those are the intimate, meaningful, durable supports that are going to be there. So we're only effective to the extent that we can engage those supports and we can integrate them into our work, and that we can become more facilitators and kind of catalysts for change rather than trying to be the service or support, because we're not always going to be there. Family and community will always be there.
In Florida, I definitely think that our young people need mentors. Our detention centers need, communities to come together, to ensure that they've got what they need, our residential facilities as well. The community is as strong as the community is, and our young people will be as strong as that community allows them to be. So, we always need mentors and people to get involved and to really understand that the majority of the population of kids in the juvenile justice system are not the kids that you see and read about in the newspapers or see on the news. These are young people that many times have been victims themselves and are acting out. They have mental health issues. And so to really, support the department and support the individual communities and really trying to ensure that we've got strong programming that can help these young people and their families so they can lead a successful life. We can provide a link to our website that allows for volunteers who are interested to participate. You can also Google us or visit us at djj.state.fl.us to find resources available in your own community.
And I would just encourage individuals to become involved in local programs in your area. One of the things that has been most valuable for us as a system in Missouri is a structure that we call community liaison councils, where members of the community are actually part of the programs in their community, and they come in and meet the young people. In some cases they might serve as a mentor, they might lead a book club, some way that they have a relational connection to the young people in the program. which does a couple of things. One, it really lets the young people in the program know that there's people in the community who care. And often we're talking about youth that feel disenfranchised and don't feel that people care. And when they don't feel that people care, then they begin to believe, why should they care? So knowing that other people really care about them helps motivate them to make positive changes. It also lets them know that people are going to be there for them when they leave. The other thing that it does is it helps the public develop accurate perceptions of the young people. So we have lots of images in our mind about the young people who are in the juvenile justice system. And I think folks who get involved will be much more hopeful about the young people that are in the system and about their potential for future success. And they'll be able to then talk about what's really needed in the programs, what young people really need, to other members of the community, which is why we call them community liaison councils. There's an old expression that says that programs don't change people, that relationships do. And it's really true, that it's really relationships that become the primary motivation for young people to make changes and for families to make the necessary changes. So it's absolutely critical that the community become involved and that we really change the relational dynamics in our communities in a positive way that supports young people's growth and change.